Hi guys, welcome back to my channel. How are you guys doing? We are going to go over delegation. It's an NCLEX review on delegation. You will get a lot of questions on delegation on your NCLEX. That's just how it works. They always bring up delegation. So what do I want you to know as far as delegation? They have 5 rights of delegation that you need to know. There are 5 rights. The first thing is right person. It means, who are you delegating to? Is the person the right person? Can the person do what you are telling them to do? Are they the right person? For instance, you will not tell a certified nursing assistant to go and flush a patient's G-tube. They are not the right person for it. That's the job of a licensed practical nurse. That's the job of the registered nurse. So you will not delegate that to a certified nursing assistant. Right task. It means, what kind of task are you telling them to do? Are you telling a LPN to go and hang an IV cardiac medication? What kind of task are you telling them to do? Are you telling a certified nursing assistant to go and suction a patient trach? So you need to know what kind of task are you telling them. It has to be the right task when you're delegating. You can't just tell them to do anything. Like I said, nursing is about people's lives. And you always have to put that in mind when you're delegating. So, for instance, when we talk about right task, a right task is telling a CNA, certified nursing assistant, to help a patient go to the bathroom. That's the right task. The right task is telling a licensed practical nurse to give a patient an oral medication. That is the right task. The right task is telling a licensed practical nurse to do a wound care of a patient. That is the right task. You need to know what kind of task are you giving people to do. The CNA, they can help a patient to the bathroom. They can turn and reposition a patient. They can give them a bath. A CNA, they cannot give patients medication. In some state, they can take vitals. They can do your vitals, actually. But they cannot give any form of medication. They cannot do wound care. So you do not delegate those kind of tasks to a nursing assistant. So you need to know, what kind of task am I delegating? What am I telling them to do? Is it within their scope of practice? Are they trained for that? Right circumstances. That is very important. You have to know what circumstance can you delegate. You can't just delegate everything as the registered nurse, because at the end of the day, you're still responsible for the patient care. So if the CNA come to you and say, oh, I went to check this patient blood pressure this morning. Our blood pressure is 80/60 or 80/40. In that kind of circumstances, you don't tell the CNA to go back and check it again. No, you as the registered nurse, you pick up your blood pressure cuff, both manual and automatic, and you go in there and check the patient blood pressure. So you need to know the circumstance in which you can delegate to your nursing assistant, to your licensed practical nurse. Because if you delegate in the wrong circumstances, it can be a problem. We are talking about somebody's life here. Right direction and right communication. So when you are delegating, when you are telling your licensed practical nurse, could you please go and check vital signs of my patient in room 201? That is not the correct delegation. You need to say, could you please go and check my patient in room 201 blood pressure and report back to me if the blood pressure is less than 80 or the diastolic is less than 60, or report back to me with their blood pressure reading. You cannot delegate halfway. You need to have the right direction. Communicate it clearly. Communicate clearly. Make sure the person that you are delegating to understand what you are saying. And if they don't understand, repeat yourself. Right supervision and evaluation. When you are delegating, understand as the registered nurse that you still have a responsibility to supervise and evaluate what you have just delegated. You need to make sure it was done right. You need to make sure that everything was done correctly. Because at the end of the day, it is still under your license. That's why after delegation, we need right supervision and right evaluation to make sure that everything was done the right way. The way you want it to be done. And if it's not done that way, then you as the registered nurse, you need to do it the way you want it to be done. That's why you go back and evaluate and you go back and supervise. So we are going to go over some NCLEX review questions on delegation.